To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about vascular screening. And to help us do that is Dr. Burkett from Surgical Associates of Neenah. Welcome, doctor. Maybe we should start off by letting our audience know what vascular disease is.
So essentially we're talking about the arterial circulatory system of our bodies.
You told me there are 4 different types of screening processes that are pretty thorough that we want to get through. Why don't we jump into that?
Correct. So the first would be carotid artery disease, which is the arteries going to through our neck to our brain, and abdominal aortic aneurysms, peripheral artery disease, which is disease of our lower extremities, and then coronary artery disease.
What do those screenings look like? So those are 4 very different parts, right? So how do we screen for those?
So for the carotid arteries, we screen with ultrasound. We're looking for a stenosis or a narrowing greater than 70%, which could then become symptomatic. For the abdominal aneurysms, we're doing abdominal ultrasounds to see if an abdominal aorta is growing larger than it should be and what is the risk of rupture in the future. For the peripheral artery disease, we're doing sequential or segmental blood pressures of the lower extremities, comparing our ankle pressures to our arm pressures, and that ideally should be 1. But if it reduces less than 70%, then patients often will get symptomatic. And then for coronary artery disease, we're doing low-dose CT scan for calcium screening.
And you were telling me earlier that these are dangerous because they're silent. We don't really outwardly know what's going on. So let's talk about the importance of early detection. What happens if we don't?
Well, we'll take carotid artery disease, for example. If someone has a stenosis that's greater than 70%, and they're oftentimes going to be asymptomatic, that things could progress fairly quickly in the next couple of years and lead to a stroke.
And without that early screening, we could just go, you could just go your whole life not having any
Correct.
idea, right?
Correct.
Let's talk about risk factors when it comes to vascular disease. Who's at risk and what are some of those behaviors?
Well, in general, tobacco and smoking obviously is a big risk. Then high blood pressure, diabetes, high cholesterol, physical inactivity is also a big factor, and then family history also plays a role. If someone in your family has had a previous stroke or heart attack or an aneurysm rupture, then you're at a higher risk for that for yourself.
All good things to understand and keep in mind. So doctor, I want to thank you helping us through vascular disease and screening, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.